Here's how to know whether you have developed late onset ADHD, which means have you developed ADHD in adulthood rather than in childhood? So the first question is, can you develop ADHD in adulthood? And the short answer is no, it's neurodevelopmental and originates in childhood. So according to diagnostic criteria, symptoms must have been present before the age of 12. Symptoms, but not necessarily diagnosis, of course. If you're diagnosed as an adult, the symptoms were likely always there and masked, misinterpreted, or not impairing enough until adulthood brought on greater demands. So, like a really stressful life in adulthood showed your weaknesses with your attention span, etc. So, why the sudden ADHD symptoms as an adult? In one case, masking is broken down. You coped well for years, but your stress, menopause, career pressure, or life overwhelmed your systems that you had built up over your childhood and youth. Another option is executive function declines. So, as we get older, stress, sleep, deprivation, trauma, or even some medical conditions can impair focus and memory. Or mimicking conditions, anxiety, depression, perimenopause, early dementia, substance use, or PTSD can mimic ADHD symptoms. I want to note that there is a debate in the scientific community about whether it can emerge for the first time in adulthood, and some argue late onset ADHD exists, but others believe it's likely undiagnosed childhood ADHD that became more obvious with age. So, what to do if you suspect you have ADHD as an adult? Track the symptoms, note patterns in attention, impulsivity, emotional regulation, and time management. Consult a specialist. A psychiatrist or neuropsychologist can evaluate for ADHD and rule out other conditions. And lastly, consider life changes. New challenges, hormonal shifts, or burnout can bring symptoms to the surface. Do you feel like you might have late onset ADHD or that you had it as a child and you've just been masking it all along? I certainly do. I feel like my brain is bouncing all over, but I certainly also living a high stress life at this moment. So perhaps it's both. Perhaps it's just the high stress is making it so my brain can't focus. What do you think?